Welcome. I'm Dr. Steve Kopetsky, a preventive cardiologist at Mayo Clinic in Rochester, Minnesota. This is the next in our series of Interview with the Experts on preventive cardiology. It's my pleasure to introduce you today to Miss Kate Russell, who's one of our outstanding clinical exercise physiologists who helps our patients with doing interval activity. And interval activity, as many of you may know, we've had previous segments on it here, is very helpful in short amounts of time to increase your cardiovascular fitness and markedly decrease your cardiovascular risk. So our segment today will be how to tell patients about adding in intervals to their physical activity program. So welcome, Kate.
Thank you. Happy to be here.
It is really great to have you. And as you and I work and see patients, we know that the interval can really be tremendously helpful to patients. And a recent study that we'll put at the on the webpage associated with this from the British Journal of Exercise Medicine just recently showed that intervals of just a little over 3 minutes can markedly reduce cardiac events, MACE, cardiac death, heart failure, stroke, heart attack by over 50%, doing just 3.4 minutes daily. So, Kate, how do we do intervals? How do you tell patients to do intervals, especially if they're unable to run?
So, interval training is really making exercise high intensity, but the heart doesn't know the difference between walking and running or swimming. Really, it just wants the muscles to be working hard. So, if you don't have a treadmill, if you're not able to run, even walking upstairs for 30 seconds, that can be an interval. If you're swimming, we're going to do 30 seconds of all out swimming versus trying to do 45 minutes of a general moderate intensity. If you can't walk or run, find an incline. Outside, if you've got a hill you could walk up or a ramp you can walk up, all of that stuff counts as long as you're working hard at it.
And then how do you judge hard? What do you tell patients to do?
So really the easiest way is to think about your breathing. In general, moderate exercise would be I'm breathing harder than baseline, but I could still talk to somebody while I'm doing this. Now for high intensity exercise, we want you working hard so that you're breathing hard and you can't necessarily talk while you're doing the interval. And if you can't talk while you're doing the interval, you're huffing and puffing, you're probably at a good level.
Okay. And what do you tell them about heart rate? Do you say follow your symptoms or your intensity rather than heart rate?
Absolutely. Your body is individual based on your medications, your biology, your genes. There's a lot of variation to heart rate in general. So if you're saying, I have to hit, say, the heart rate of 140, you may never be able to hit 140 because your genetics don't allow you, or you're on a beta blocker, or other reasons why. And
Sure.
we don't want you to work so hard that you can't maintain the intervals. However, if you say I want to hit 140, but the work feels somewhat hard, not very hard, then you're not getting all the benefit that you could. So really think about how light or hard you feel the work is. If it's too hard to maintain the interval pace, take it down a little bit. If you can take it up and work a little harder, we want you to.
So I would suspect that built into that, the more intervals you do, you'll have to do a little more as you get in better shape to achieve that same intensity. Is that correct?
Absolutely. So exercise should get easier as we do it, but it should never be easy. And if it is easy, then we probably got to take it up a notch.
Gotcha. So what specifically, how do you tell them to do it? Say if they're swimming or on the treadmill or elliptical or walking, out in the woods, do they start out a little slower, they get warmed up and then go hard? And then how long do they go hard?
Absolutely. So let's use a treadmill as an example. But again, you can do this in any modality that works for you. So we always recommend at least a little bit of a warm up, at least 2 or 3 minutes. If you need a little more time, up to 5 minutes of just slowly increasing your rate just to get your heart rate and your blood pressure up above baseline. At that point, we want you to work very hard, either with speed or incline or some combination, for at least 30 seconds. It should be all out. I can't talk. I'm huffing and puffing. At the end of that 30 seconds, we don't want you to stop. We want you to slow down, do an active cool down, slow on the flat, catch your breath. With the cool down, really the goal is that you're recovered enough that you can work at a similar intensity for the next interval. So you don't want to shortchange yourself and miss out on the intensity that you can do, but you also don't want to sit around doing an active recovery for 5 minutes when you've got to get back to work.
Mhm. Although I assume sometimes when patients start this out, they may need a 5-minute recovery.
Absolutely. And that's all part of the intervals is, your baseline fitness, how long the interval is, the modality. Sometimes you're going to need a longer recovery, and that's fine. As long as you're giving yourself enough recovery that you can hit it hard for another interval, give your
Mhm.
body what it needs.
And then how many intervals should one do when they're out doing intervals? Is that just more limited by the amount of time you have?
To some extent, typically we say that about 30 minutes of steady state exercise is typically equivalent to about 20 minutes, 15 minutes of doing intervals. So, if you spend 3 or 4 minutes doing a warm up, you do 4 or 5 intervals that are a minute with a 2-minute recovery in between and another 3 or 4 minutes of recovery, you've probably got 15 to 20 minutes there and you've got everything you need. If you can only do 30 seconds on, 30 seconds off, I've got 10 minutes, fantastic. Really, the goal is to do whatever you can in whatever time you have. Just work hard while you're doing it.
Good. And so the working hard can be the burn in your legs. It can be how difficult it is to breathe. It's not just one thing.
Correct. And we want the intensity to be low enough that you can make it for the full interval time. So, if you take off sprinting, you may not be able to go for the full 30 seconds. So we want to take the intensity down that we can make that full time. But, you also don't want to spend so much time at moderate exercise and miss out on the intensity. So it's really a moderation of how long do I need to go and how hard can I work in order to make that full time.
Yeah, no, that's great. And so you talked about intensity and duration. So it sounds like intensity it wins out. Is that how you see it?
Yes, absolutely. Really, the goal is if you can work harder, we want you to. You set the time that you can go for each interval, and then just try to work as hard as you can for that amount of time.
Mhm. Now, some of the studies have shown, very short intervals, even a few seconds can actually start to change your metabolome, your insulin sensitivity and things like that.
Absolutely.
We just have to have patients remember that a 2-second interval may help you, but it's not adequate. You have to do a little more, right?
Correct. Yes. And if that's where you're starting at, it is fine to start with a 10-second interval if that's all that you have. But then we want to be working at how can I progress it? How can I make it 15 seconds, 30 seconds, a minute? Once I make a minute, can I take up the intensity to lengthen out that interval? So it should always be how can I make this a little bit tougher?
Yeah. Okay. What about people that say, my right knee is killing me. I can't do anything. How do you help them?
There's a lot of different varieties of exercise that you can do. Secondhand equipment is very easy to come by. Bikes are a great option, especially if you can't spin fast. Add resistance to the bike. Semi-recumbent bikes, ellipticals, same thing. If you can't pedal faster, then add resistance to it. Water walking is fantastic exercise because you have to move against the resistance of the water. And so you don't have to be going very fast to be working very hard. So it's all about finding a different modality that works for you and then making it hard in whatever way you can.
Good. So as humans, we have about 200 joints in our body. If one doesn't work, use the other 199.
Absolutely. Absolutely. There's even arm bikes, arm ergometers, that kind of stuff. Find something that works for you and just work hard at it.
Yeah, that's great advice. So it can be in the water, it can be on recumbents, it can be on anything you want to do, as long as you can do it.
You betcha. Inside, outside, walking, running, biking, swimming, cross country skiing,
Okay.
whatever floats your boat.
Yeah, no, that's terrific. That's perfect. Now, some of the studies have shown that the interval actually changes things more than continuous exercise, even for isocaloric, the same amount of calories
Mm-hmm.
spent. It seems to raise our HDL more than continuous exercise, lower our triglycerides more, helps blood pressure, actually changes our messenger RNA of our endothelium, so they put out more vasodilatory substances. So these intervals are really very interesting. And why do you think they're so good for us? Is this what our species has done for millions of years, or did we used to get up in the cave in the morning and jog for an hour?
Well, I mean, in general, that is how life works, is it's short periods of working hard and then standing around or walking slow. You want to chase grandkids across the yard, that's going to be for 30 seconds. You're not doing that for 30 minutes at a time. If you are late for work and you got to get up to the third floor, you got to be able to hike up those stairs. But then once you get there, you're not going to keep running down the hallway.
Mhm.
So life in general is about how can I efficiently do something that's hard and do it well. And then I have time to relax and to catch my breath afterwards. So intervals are really training for life.
That's such great advice. And boy, who has 45 minutes to go to the gym? That just doesn't happen anymore, does it?
Not nowadays, absolutely not.
Yeah. So, Kate Russell, that's been great advice you've given us, pointing out that intervals can change us and improve our lifespan and reduce our cardiac events, even short intervals, doing ideally between 30 seconds, not more than 2 minutes, maybe 4 or 5 intervals, whatever you can achieve that day with a time limitation. Make sure you slow down in between, get your breath back. And there's many, many ways, almost infinite number of ways you can do intervals.
Absolutely. In whatever way you can, just work hard at it.
Great. Well, thank you, Kate, for joining us today. It's been very informative, and I think it'll help our people in the pod world too.
Wonderful. Thank you so much. Have a great day.